The focus of this session will be on psychological treatment strategies that can be useful in helping older adults manage pain. In this series, the learning objectives are to describe brief psychological strategies for pain management that can be used in the hospital or long-term care home, and to describe how to apply a psychological strategy. In Session 7, you learned about the 4 P's of pain management that include pharmacological, physical, psychological, and prevention strategies. Most people who have pain benefit from a mixture of treatment strategies from all 4 of these categories. Each category offers a range of strategies that may be effective for different people or at different times. It's important to remember that non-pharmacologic strategies are not an alternative to pharmacologic strategies, and vice versa. All 4 categories of intervention can be used concurrently once the effectiveness of each treatment strategy has been established. Non-pharmacologic strategies may reduce medication requirements, and medication may contribute to pain relief so that the older adult can engage in psychological or physical strategies. A pain-relieving strategy can be labeled a psychological strategy if it engages the thoughts, attention, emotions, or feelings of the individual in a way that reduces the perception of pain or distress related to pain. There are many different strategies that can be described as psychological interventions for pain management. Some are easy to apply, require little to no training, and therefore can be used by healthcare providers, the clients themselves, or family members. Some strategies have limited short-term benefit and are better for managing brief, acute pain, and others are more intensive interventions that require significant levels of client participation and are applied only by trained healthcare providers. For example, distraction and relaxation are psychological strategies that may be useful during a brief painful procedure, such as an IV start or dressing change. Relaxation techniques, such as slow, deep breathing, are strategies that can be effective for brief painful events, but if practiced regularly, they can also be helpful for managing chronic pain. For older adults who have the cognitive and attention capacity to participate in more involved psychological strategies, education about how pain works, mindfulness meditation, mind-body therapies, acceptance therapy, stress management training, cognitive behavioral therapy, and hypnosis are interventions that may help manage either acute or chronic pain. So far, there is little research to guide clinicians on when to select one strategy over another. These decisions will need to be based on the client's capacity for involvement, his or her preferences, and trials to determine which strategies are helpful under different circumstances. Here is an example of how distraction, visualization, and deep breathing might be used together before and during a dressing change to reduce pain.
Anna, I wonder if you remember being a child and blowing on a dandelion puffball.
Oh, I remember doing that.
Yeah? What was that like?
Oh, it was kind of fun.
Okay. I'm wondering if I can ask you in a few minutes. We're going to ask you to close your eyes, and I'm going to ask you to breathe out a little bit, and we'll remember what it was like to be a child like that. As I take this off, it's going to make it a lot easier, okay? All right.
I can do that.
Okay. So, where would you have been when you were blowing on a puffball?
Oh, we usually did it at recess at school.
Okay.
Yeah.
All right. And who were you with?
My best friend. My best friend and I would always do this.
Okay. Well, let's take you back there. So how about we remember being in a field in your bare feet? Okay. Well, how about you close your eyes and imagine that warm, sunny day with your best friend, and you pick up a dandelion and you hold it in front of you. Take a deep breath and blow, and watch the seeds float away. There's still some seeds left on there. So take another deep breath, and now slowly blow out. And one last time, and blow the last of those seeds away. And they're carried off into the wind. Now your breathing returns to normal. And we're done.
That's an example of how psychological strategies can be used to prevent or reduce pain during a treatment procedure. In this case, the nurse combined deep breathing and visualization. This is a strategy that the client could also practice daily to reduce chronic pain. To summarize, there are many psychological strategies that can be used. Some are easy to use during brief procedures, others require the skills of a trained mental health care provider, and also require the client to have the cognitive capacity to engage in therapy. It's important to try a range of different approaches and to use psychological interventions with pharmaceutical, physical, and prevention treatments to minimize pain.